Dietitians are qualified and regulated healthcare professionals with extensive training in nutrition. So our aim is to assess, diagnose and treat nutritional problems. We do that by using scientific research and clinical guidelines, and we translate those into practical advice for patients looking at their individual case. Cancer is quite a shocking diagnosis, and often, especially close to the time of diagnosis, diet isn't something that is on someone's mind. They've got other questions. They're thinking, am I going to live? What's going to happen to me? Just what's going on? We will work with them to understand their diagnosis, their treatment, and what their goals are, and we will figure out a nutritional plan to basically optimize their diet in an attempt to manage any symptoms they've got and to prevent them from becoming frail, essentially. We're trying to keep people as fit and strong as possible. Patients often think that dietitians are the food police, so they might get a call from a dietitian and think, oh, what's this about? But actually, we're on the patient's side. We are there to help optimize your diet. We're not there to make any judgments. Often people think they're going to be told off for eating a chocolate bar, but actually, a chocolate bar can be quite healthy if you are malnourished and needing to keep your strength up. So it's often not what people think it is. After a patient has been diagnosed with cancer, nutrition is going to be part of the overall assessment that's made by the wider cancer team. We will accept referrals from anyone in the cancer team if they have concerns based on the assessment that they have performed. The multidisciplinary team is huge for dietitians, so we work closely with patients, doctors and nurses to make sure that they are prescribed the right medications to help manage any symptoms that might be affecting their appetite. Beyond this, we work quite closely with the cancer therapy team. We have a real interest in helping people to maintain their muscle mass because we know that those with a higher muscle mass are going to do better on treatment and they're going to be stronger after treatment, have a better quality of life, better outcomes. Some of the most common feedback we get from patients is that before they spoke with us, they had no idea what they were doing with their diet. So maybe they have diabetes, but also they're incredibly malnourished and they need to put some weight on to help them tolerate their treatment. What do? On the one side, should they be eating lots of sugar to put weight on, or should they be restricting their sugar because with everything that's going on, maybe their blood sugars are awful at the moment? We help patients put everything into context and we bring in the right people so that we can holistically address the problem from all angles. And getting that feedback is really reassuring. Suddenly, to have the feedback, suddenly I know what I'm doing with my diet. That's what we want to hear. What drives me to do this job is seeing the impact that good nutrition can have on someone. So it can take someone from the very bottom of the barrel to suddenly feeling energized again, having some hope. Nutrition, it doesn't just affect the physical, it also affects the mental. All the different nutrients we get in our diet have various different impacts, and if you're short of one or more nutrients, it can affect everything. What drives me is seeing how powerful it can be when someone is malnourished versus when they become well nourished, and seeing the effect that can have on how they tolerate treatment.